One of the most powerful aspects of simulation-based education is the opportunity to discuss with scenario participants what they just experienced. Simulation pioneers Fanning and Gaba explain that facilitated debriefing is the attempt to bridge the gap between experiencing an event and making sense of it. There are various methods used to facilitate a debriefing, but the one that we have found most useful is the model used by the Center for Medical Simulation in Cambridge, Massachusetts.
This model divides debriefing into 3 phases. The first phase is the reaction phase, the second is the understanding phase, and the third is the summary phase. We're going to briefly explain each phase and why we think these are so important to this aspect of simulation methodology. First, the reactions phase is an opportunity to sit with participants and allow them to express how they feel about what just happened.
Following a scenario, participants almost always need an opportunity to vent about something. This includes things that may have gone wrong, such as an equipment failure or issues they had with realism. If we ignore students' feelings and rather go straight to what happened in the scenario, then participants will have unresolved feelings including anger, and this may interrupt the subsequent debriefing dialogue. Let me give you an example of the kinds of things you might hear in the reactions phase. That was so frustrating. I didn't know where I could find the equipment, or I didn't know how to call for help.
Bad as you thought, better than you thought.
Awful.
Awful. What's awful about it?
I never even turned the O2 on.
Well, I think that in my mind, the thing that's not coming up, but we can't turn it on because we're thinking when I stop the stuff and they say we don't use oxygen because I fed the dummy. That's why in my mind I didn't turn it on. I didn't put it in my mind.
I was thinking you had so much.
In my mind, I think that the baby needs oxygen, but because the situation, so I can't turn oxygen up. But I didn't talk it out.
I was thinking that the new guidelines are accepting more of lower saturations, but the fact that the baby probably was bigger and probably closer to term, we should have increased the oxygen, even though the saturation had it been a smaller baby, then maybe that would have been acceptable. I guess that's what I was thinking in my mind was.
So let's back up just a couple minutes, or just like sort of to the beginning. So when you first came in, and what was your mental model of what was happening?
Oh my gosh, I didn't expect to be born in the bed outside.
Neither did I.
Where's the bag mask equipment in here?
Yeah.
Okay, so you were in
And
this.
can I pick this baby up and go, or do I have to
Yeah, it
just
wasn't clear when I
resuscitate?
asked
I
you to
wasn't
have
sure
a
if I
warmer
had
set
to.
up. I never really got an answer. I wanted to know what was available.
And I wasn't
Okay.
sure if the baby was bad enough that we needed to do something.
You can also use this time as an opportunity to listen for comments that relate to areas or topics that you want to delve more into as debriefing proceeds. The reactions phase also becomes an opportunity for us, the facilitator or scenario director, to recognize to the participants some of the limitations of simulation that are commonly encountered. For example, sim labs are frequently not exact replicas of the workspace that participants are used to. That said, it is advisable that we listen to criticism so that we can improve things like bed space setup, or remembering to tell them in pre-briefing how to call for more help, or to better explain what the mannequin can and can't do. That way we can minimize those complaints in the future.
Let's talk now about the next stage of debriefing, which is called the understanding phase. The stable scenarios all have specific cognitive, technical, and behavioral objectives. As we observe the scenario in action, we evaluate how well these objectives were achieved. Therefore, it is recommended that you use the objective worksheets that are provided for every scenario. When you debrief, you can use the worksheet, if necessary, to help guide the discussion. The understanding phase is the heart of the debriefing, and it's when students explore what and why things happened. Students often reveal their motivations for certain actions, their prior understanding of medical situations, and often they identify their weaknesses in one aspect or another when dealing with stressful, time-pressured clinical events. In debriefing, the facilitator should guide the discussion, not dominate it. The group should all participate, and in the end, the goal is for them to develop new understanding of how they and their team members contributed to the care of the patient. Ultimately, this will lead to better transfer of content to clinical practice.
I kind of wish I had spoken up sooner regarding the UVC, because when Christy was saying she was going to try for a high line, I was thinking, why not just go, put a low line in? So I kind of wish I had spoken up, before we waited a little while before that happened.
What kept you from saying something?
I guess just, I'm kind of in the background there. I'm kind of watching the whole thing, and, and I think, Christy's in control and she's doing a good job, and I'm thinking, I'm just going to go ahead and let her do her thing, and I just kind of just hesitated there thinking, I'll just see where this goes.
That happens a lot. Somebody's the practitioner,
Yes,
the
or the
neonatologist, you
physician.
think, I'm the RN, there must be a good reason why she's trying to put the line at that point, and so you feel a little insecure saying what you're thinking for fear they might retaliate or be upset with you for, speaking out against maybe what they're already doing.
What would you have done if Trish would have said earlier, Christy, why not try a low-lying UV? How would that have felt?
I think I would have thought about it and thought, I think that sounds like a pretty good idea, given the fact that the baby continues to decompensate. That would have been a good first step, and then I could have proceeded on later once the baby was stabilized to a regular, high-positioned UVC. So,
yeah. I encourage you guys to overcome some of those fears around these hierarchies. A better patient outcome is going to come when everybody feels safe contributing what they understand toward the care of the patient. And a lot of error can arise when we have these intimidating experiences and we don't speak up. So it's nice to hear that would have been received really well. Patient comes first, so definitely feel empowered to share your thoughts around the best care for our patients in these situations. The final phase of the debriefing is called the summary phase. As you wrap up, ask students to summarize what they learned. Try to include each participant in this self-reflection, as it's important to allow everyone a chance to speak up. You might start the summary phase by asking students to remark on something they learned that they can use in the clinical setting. I often start this discussion by saying, let's go around the table and say one thing we learned from the scenario that we can apply to our clinical setting. Other ideas are to say things like, what would you do differently next time? Or, is there anything you'd do differently if you found yourself in this situation again? Or, what are your take-home messages from this scenario? When everyone is finished talking, you can move on to the next scenario, or if that was the last scenario, you can thank them for their participation and remind them about keeping the events of the day confidential.
It takes an extraordinary amount of work to develop scenarios. And particularly with these scenarios, there's been an extraordinary amount of work done all over the country really to assure that they are valid and reliable. And the work that's been done is to make it a valuable educational experience for everybody that participates. So if we leave here and talk about particular scenarios and talk about what happened, we're taking away the value, at least some of the value of that educational experience for the people who haven't been through the simulation yet. And what I mean is that if certain things happen or certain kinds of things are surprising during a simulation, and part of the learning experience is figuring out as a team how to problem solve, how to get from point A to point B. If we share that information with individuals who haven't yet gone through this particular course, their educational experience is less, it's compromised, because rather than having to sort of think things through and develop their own problem-solving abilities as a team, we've given them the answer. And it's not because we want to trick or anybody or anything along those lines. It's really about everybody having the same valuable educational experience, which is going to occur because they're seeing it for the first time. So it's respecting both the amount of work that goes into these, it's respecting that we want everybody to have the same valuable educational experience, and also that we are going to talk about each other's individual performance.